particular section, there are clinical situations. There could be either be preoperative patients who have been admitted for workup or for optimization. Such cases can be cases like jaundice patients who need to be optimized before any hepatobiliary surgery. This could be because of patients of malignancy sometimes who need optimization or correction of their coagulation parameters. More importantly and commonly, these are post-operative patients who have undergone elective or emergency surgery, and they are in front of you. A situation is posed, and these patients, because they are post-operative, they will be having some monitors attached to them, they will be having some oxygen lines, they may have Ryle's tubes, they will have drains, they will have urinary catheters, they will have central venous lines. There could be a stoma, there could be open laparotomy wound, like a wound which has been dressed, there could be a laparostomy, there could be a VAC, anything. And the questions will rotate around the scenario. So, in this particular scenario which is there, we are talking about a case of post-operative patient who has undergone a laparotomy for CA rectum, and this was a planned elective surgery. So remember, the examiner is telling you this particular brief. It is day 5, 5th post-operative day after a sigmoid colectomy for a sigmoid colon adenocarcinoma of the colon, where a sigmoid colectomy with an end-to-end anastomosis was done, and the patient was eating orally and was fine till about 4 days back, for the last 4 days, when for the last 1 day he is feeling very low. He has started complaining of pain in the abdomen. The vitals that are given to you is that the pulse is 110 per minute, so he is tachycardic. Blood pressure is all right, but on the lower side, 104/70. And the examination findings that have been given to you is that the abdomen is slightly distended. There is some amount of low-grade fever, which the nurse has reported. Patient has stopped eating or drinking because he is feeling nauseous, and he was already mobilizing. He was eating around, so he did not have any catheter, and the urine output told to you by the nurse is that he just passed urine once last night and has not passed since. So with this particular background, the examiner tells you what you are the resident on duty who has come to assess this patient on behalf of your consultant. So what will you do? How will you proceed?